The COVID Delta variant is now the most dominant strain of COVID-19 in the country, and a small portion of COVID cases in our region are confirmed Delta variants. This according to local health officials. Erica Koss spoke to a local infectious disease expert about the severity of this strain and who's at risk. She has this report for us.
County officials and local health experts say we're in a good place overall in terms of vaccination efforts, but there's still work to do in the community, especially with this new variant.
As a county as a whole, we're doing very well. So we have for 18 and over, we're above 70% in our vaccination rates.
But there's still a concern. The coronavirus is mutating with every person it infects, and right now the Delta variant is of most concern. It's highly transmissible, however, not any more severe than a normal strain. That's according to Dr. Ed Walsh with Rochester Regional Health.
Fortunately, we're not seeing too much coming into the hospitals right now. And I think in large part that's because we've done pretty well vaccinating our most highly vulnerable.
But there's the unvaccinated population that's most at risk right now.
They are older, if they have high-risk conditions. They need to be very cautious, and the recommendation would be to get vaccinated, obviously.
And in Monroe County, there are still some neighborhoods with extremely low vaccination rates. County Executive Adam Bello says to solve this, doctors and community leaders are quite literally meeting people where they're at. They're going door to door, answering questions, providing information, and using mobile vaccine clinics.
What's working best right now is the one-on-one conversations that are taking place between trusted community voices and healthcare providers with community members. And those one-on-one conversations take time.
Now, the unvaccinated population does include children ages 12 and under who can't get the vaccine, but Dr. Walsh says parents should take comfort in knowing the risk is very small for that age group. And if you have pre-existing conditions, just make sure you're extra cautious around those ages as they could be carrying this variant. In Rochester, Erica Koss, News 8.